Hi, and welcome back to our channel. Today, we're diving into the early signs of HIV, specifically those that can appear around 1 month after exposure. Catching HIV early can make a world of difference in managing the condition and preventing its progression. Ignoring subtle warnings can delay diagnosis, and early treatment is key to a long and healthy life. Many early symptoms are general and can be mistaken for other common illnesses like the flu. We're going to break down 16 potential early signs, so you have the knowledge to listen to your body. Remember, this video is for informational purposes. The only way to know your HIV status for sure is to get tested. One of the most common early signs of HIV is a fever, often appearing within 2 to 4 weeks after exposure. This fever is part of the acute retroviral syndrome, ARS, your body's natural response to the HIV infection. When HIV enters your system, your immune cells recognize a foreign invader and kick into high gear, causing an increase in your core body temperature. If you've recently engaged in activities that carry a risk of HIV transmission and then develop a fever, it's a signal that shouldn't be ignored. While a fever on its own can be caused by countless things, its appearance after a potential exposure event warrants closer attention. If you experience an unexplained fever a few weeks after a possible exposure, don't just brush it off. Consider it a prompt from your body to pay closer attention. Profound fatigue is a common early sign of HIV infection. This fatigue is intense and persistent, not improving with rest. It's due to your body fighting the virus. If this extreme fatigue appears suddenly, consider getting checked. Swollen lymph nodes or lymphadenopathy are another key sign during the acute phase of HIV infection. When your body is fighting an infection, these lymph nodes can become swollen, tender, and sometimes painful. During an acute HIV infection, it's common for lymph nodes in several areas to swell simultaneously. This widespread swelling is a strong indication that your immune system is mounting a significant response to something systemic. If you discover swollen lymph nodes, especially if they appear in several locations and are accompanied by other symptoms like fever and fatigue, it's a significant sign. If this occurs a few weeks after a potential HIV exposure, it should certainly prompt a visit to your doctor for evaluation and testing. A sore throat is another symptom that frequently appears during the acute stage of HIV infection. This isn't just a mild scratchiness. It can be quite painful, making swallowing difficult and uncomfortable. The soreness is typically caused by inflammation of the pharynx or the tonsils. If this sore throat develops in the context of other flu-like symptoms, fever, fatigue, swollen glands, and particularly if it occurs a few weeks after a potential HIV exposure, it takes on greater significance. If you have a persistent or severe sore throat that doesn't improve with typical home remedies, or if it's accompanied by other concerning signs, it's always wise to seek medical advice. A healthcare provider can perform a throat swab to rule out bacterial infections and consider other possibilities, including acute HIV infection. A skin rash is a relatively common symptom of acute HIV infection, appearing in a significant number of people during the seroconversion phase. The appearance of the HIV rash can vary, but it's often described as maculopapular, consisting of both flat, discolored areas and small raised bumps. The rash most commonly appears on the torso, but can also spread to the face, neck, arms, and legs. The development of this rash is another manifestation of the body's immune response to the virus. If a non-itchy, widespread rash appears, particularly on the trunk, and is accompanied by fever, fatigue, sore throat, and swollen lymph nodes, it should raise a red flag for possible acute HIV infection. A healthcare provider will consider the rash's appearance, distribution, and the presence of other symptoms. Muscle aches or myalgia and joint pain or arthralgia are also frequently reported during acute HIV infection. These aches and pains are part of the systemic inflammatory response triggered by the HIV virus. As your immune system battles the infection, it releases chemicals called cytokines, causing widespread inflammation throughout the body. If these muscle and joint aches appear suddenly, are widespread, and occur alongside other symptoms like fever, rash, or swollen lymph nodes, particularly after a potential HIV exposure, they become more significant. While taking over-the-counter pain relievers might provide some temporary relief, It's crucial to consider the underlying cause if these symptoms persist. Don't hesitate to discuss these pains with your doctor, especially if they are unusual for you. Headaches are another common complaint during the acute phase of HIV infection. The headache associated with ARS can be quite severe, persistent, and may feel different from headaches you've experienced before. This headache is often related to the overall inflammatory state of the body during seroconversion. If you develop a new, unusual, or particularly severe headache, especially if it's accompanied by fever, fatigue, rash, or other flu-like symptoms, and if this occurs within a few weeks of a potential HIV exposure, it warrants medical attention. It's crucial to describe the nature of your headache to your doctor, its location, severity, what makes it better or worse, and any associated symptoms. While most headaches are not serious, in the context of ARS, it's an important piece of the clinical picture. Nausea and vomiting can be symptoms of acute HIV infection. These symptoms are part of the body's reaction to the virus. The immune system's activation affects gut motility and sensitivity. If these symptoms occur with flu-like signs after potential HIV exposure, seek medical advice. Stay hydrated and consult a doctor if symptoms persist. Your doctor can help determine the cause and recommend management. Night sweats can occur during acute HIV infection. These are drenching sweats that soak through pajamas and bed sheets. They are related to the body's efforts to regulate temperature and fight infection. If you experience these sweats with other symptoms like fever or swollen lymph nodes, seek medical advice. Mouth ulcers, also known as canker sores, can be a sign of acute HIV infection. These small, painful sores can appear inside your lips, gums, tongue, or mouth. They may result from immune system disruption and inflammation due to the virus. If you have multiple mouth ulcers with flu-like symptoms after potential HIV exposure, seek medical advice. Diarrhea can manifest during acute HIV infection. It's often a result of the body's inflammatory response to the virus. Persistent diarrhea can lead to dehydration and electrolyte imbalances. Seek medical advice if diarrhea lasts more than a few days. Your doctor can help manage symptoms and ensure hydration. Unexplained weight loss can sometimes occur during acute HIV infection. Symptoms like loss of appetite, nausea, mouth sores, diarrhea, and vomiting can lead to weight loss. Increased metabolic demands from fighting the infection also contribute. If you notice weight loss with fever, fatigue, or night sweats, especially after potential HIV exposure, discuss it with your healthcare provider. They will assess the weight loss and other symptoms to determine the cause. A persistent dry cough can sometimes be a symptom of acute HIV infection. This isn't usually a phlegmy, productive cough like you might get with bronchitis or pneumonia, though those can occur later in HIV if untreated. Instead, it's often a dry, irritating cough that lingers. If you develop a new cough, particularly a dry and persistent one, that occurs along with other symptoms like fever, fatigue, sore throat, or muscle aches, and this happens within a few weeks of a potential HIV exposure, it should be considered as part of the possible ARS picture. While a cough is a very non-specific symptom, its presence in the constellation of other signs can be relevant. Your doctor can help assess the nature of your cough and determine if further investigation is needed. Shortness of breath can occur during acute HIV infection. It may feel like not getting enough air, chest tightness, or rapid breathing. Seek medical evaluation if you experience this, especially with fever, cough, or fatigue. This is not a symptom to wait out. A healthcare provider will assess your lung function and oxygen levels. Any new or unexplained shortness of breath should always be taken seriously. Oral thrush or recurrent vaginal yeast infections can indicate immune system changes. Oral thrush presents as creamy white patches, which can be painful or cause a cottony feeling. HIV disrupts the balance of microorganisms, including Candida yeast. Recurrent yeast infections or oral thrush, especially with fatigue or weight loss, should be mentioned to your doctor. These symptoms, in the context of potential exposure, may prompt HIV testing. Beyond the common headache, acute HIV infection can cause neurological symptoms. These include photophobia, neck stiffness, confusion, and mood changes. Seek urgent care if severe symptoms occur, especially with potential HIV exposure. We've covered early signs of HIV that can appear about a month after exposure. Symptoms like fever, fatigue, or sore throat can mimic common illnesses. These symptoms are not definitive proof of HIV. The only way to know for sure is to get tested. Modern HIV tests are incredibly accurate. Consult a healthcare provider if you've had a recent potential exposure. Knowing your status is an act of self-care. Take that step for your health and peace of mind. Thank you for watching, stay informed, and take care of yourselves.